Hello, this is Kayla Hutton from Spring Arbor University presenting a PowerPoint on Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease is a form of dementia not many have heard of. CJD, Creutzfeldt-Jakob disease, is also known as a prion disease, which occurs when the prion proteins throughout the body begin folding into abnormal 3D shapes, eventually affecting and changing the prion proteins within the brain. The damages that occur within the brain end up leaving individuals with a rapid decline in thinking and reasoning, as well as involuntary muscle movements, confusion, unsteady gait, and changes in mood. There are three main types of CJD, which are sporadic, hereditary, and acquired or variant. Sporadic CJD is the most common of the three. It is unknown why it occurs and typically seen around 65 years of age, and familial CJD is inherited and is rare. Lastly, there is acquired CJD, which includes a form of CJD that is related to mad cow disease, known as variant. Variant CJD occurs by consuming infected meat and is actually believed to cause the same disease in cows as humans. CJD is very rare, occurring in about 1 in 1 million people worldwide annually, with a mortality rate of 90%. The average rate of onset ranges between 50 and 70, but has been recorded in individuals as young as 21 years old and as old as 80. The causes of CJD remain unknown, therefore risk factors are unable to be obtained. It is said that the disease begins when those prion proteins begin to spontaneously misfold, ultimately creating a domino effect throughout the brain. As stated before, sporadic CJD tends to develop in adults older than 60 and accounts for 85% of cases. Hereditary CJD may be discovered as young as 20 and occurs in 10 to 15% of individuals. The odds of passing a mutated gene onto an offspring is about 50% should the affected parent have the mutation and is considered autosomal. Variant CJD makes up less than 1% of the population, with CJD claiming approximately 228 lives worldwide since 1996. CJD is not believed to be transmitted by air contact or touch. Instead, has been spread to others in grafts of dura mater, transplanted corneas, implantation of inadequately sterilized electrodes in the brain, and injection of contaminated pituitary growth hormone taken from human pituitary glands in cadavers. Variant CJD is believed to occur when consumption of contaminated meat is consumed in humans. Unfortunately, CJD results in a rapid mental deterioration, causing individuals to live approximately a year's length. Some of the more common early symptoms to occur include depression, memory loss, sudden jerky movements, dysphagia, and dysphagia. Individuals in the later stages may sustain blindness, aphasia, ataxia, and eventual coma. Individuals suffering from variant CJD may encounter psychiatric symptoms such as loss of ability to think, reason, and remember earlier in the disease versus later, and may have a longer duration of 12 to 14 months. As a nurse, one way to begin diagnosing a patient with CJD would start with a thorough medical history, including physical examination. As the patient may already be advanced into the disease, it would be beneficial to have somebody at the appointment who knew the patient prior to their medical decline to adequately answer questions so the patient is not misdiagnosed with similar diseases such as Alzheimer's and Huntington's. EEGs may be beneficial to someone with CJD as it measures the brain's electrical activity pattern. MRIs may also be able to detect brain changes that are consistent with CJD, and a spinal tap will check spinal fluid for the presence of specific proteins. Tissue biopsy or autopsy is ultimately the gold standard for a definitive diagnosis for CJD. Monitoring changes in a patient's MRI were proved to be effective in diagnosing patients, with approximately 81% of patients receiving an accurate diagnosis. Thank you.